And everyone, we are recording this and we'll make this recording available to all the membership. So Kathy, why don't you go ahead and get started?
Okay. So I want to welcome you all here today. I'm excited to do this. The topic kind of makes me feel kind of frustrated and crazy and all of that, because it just seems to never end. But I think it's an important topic, and figure out how do we move forward in the craziness that we're dealing with today. So for those of you who don't know me, my name is Kathy Barkdull. I was in parish ministry as office manager, DRE, pastoral associate, RCIA director, a lot of different things for about 30 years. And then I went and worked with the diocese for 6 years to do online webinar catechist certification training. And so my full-time ministry has ended, but that's where my roots are. And knowing the struggles that all of you are still facing in whatever the ministry is that that you are dealing with at this time. So let's begin. Okay. I can get it to move. Here we go. Just get the announcements over first. Just that, as we all know, NOM lives, breathes, exists on our contributions. And so if there's anything at all that you're able to donate towards NOM, to just go to the website and just nom.org/donations. And every little bit helps, even if it's just a small amount. Every little bit will help us to keep doing things like this, to be able to do presentations, to be able to keep people informed, and to be able to continue the mission of NOM. And also, if you know of anyone who wants to become a member or who needs to become a member, to just log on to the website and just be able to click on the little join link at the top. The website is very user-friendly anymore. And so they start at a little as $35 for those who are students or retired like myself, and full-time memberships at $95. And I know that things are going to be changing a little bit after the first of the year. So if you know someone who wants to get in on these rates, I can't remember if the rates are going up or not, but they will be changing a little bit. So anyway, just pass that information along. So I'd like to begin with prayer. And as we place ourselves in the presence of God, which during this time, it just seems like that's about all we can rely on to be there as a steady guide for all of us. We begin in the name of the Father, and of the Son, and of the Holy Spirit. Dear Lord, at this time of what seems like an endless pandemic, help us foster respect and solidarity with others, especially those who are the most vulnerable. Help us remain calm in this time of uncertainty, just as we thought our lives were returning to a resemblance of our old lives. Help us shut out the noise of misinformation and rumors. Help us have a grateful heart for the time we can spend with family and friends. Help us continue to find moments of prayer and reflection for emotional, physical, and spiritual renewal. Help us find ways to cultivate responsibility, patience, and hope. And we ask this in your name. Amen. Father, and Son, and Holy Spirit. So let's begin. And if at this point, if you could make sure that you are muted And then there will be plenty of times. I want to make this as interactive as possible. So there will be several different times where we will have some discussions. So, but then that way we can make sure, and if it's like my house where if you have a cat fight behind the door or whatever, you want to make sure that things are peaceful. So as we know, I'm going to go back just a little bit. And at this time last year, our world turned upside down with this whole COVID mess. But little did we know how those disruptions to our daily lives would be more than we ever could have imagined. I for one, I had no idea it was going to be this big of a thing when we first started. And when, it wasn't long before we were doing all the social distancing. We couldn't shake hands. We couldn't give people hugs. The grocery stores started putting those little markers in front of the check stands and the one-way signs down the aisle so that you could only go one way or the other so that you wouldn't be passing people as you went. And a lot of people began working remotely because they couldn't be in that atmosphere of being too close to people. There was a lot of isolation. All of a sudden, we found ourselves staying at home and not being with others. We were all wearing masks everywhere we went. The one that hit me the hardest was all the cancellations, the things that we had all looked forward to. I know I had 2 family reunions, a 50th class reunion, and the time we have an annual gathering with our 3 daughters and our 5 grandchildren who come every single summer. And we weren't able to do that last year. All of that had to be canceled because we just wanted to keep everyone safe. And I have a 90-year-old mother-in-law who we wanted to protect. We wanted to keep her safe. So through all of this, the social distancing, the isolation, the masks and everything, and businesses were closing. Bars closed, restaurants closed, theaters closed, churches closed. And there was a lot of unemployment. People just, there wasn't the business for them to come in. And so a lot of people either were furloughed or lost their jobs entirely. We all found ourselves being experts at online liturgy, which in some ways is kind of cool, because if you don't like the way your pastor does his homily, you could kind of web surf and find liturgies that you liked watching, and we got engaged that way. So basically 2020 was just an emotional roller coaster, and where we all faced a lot of uncertainty, a lot of frustration, a lot of worry. There was a lot of anger, when we couldn't do the things we wanted to do, sadness, and an all-out just numbness. But then 2021 came, and we kept hearing about this wonderful vaccine that was coming down the pike. And as soon as those pharmaceutical companies got that emergency authorization, we started standing in line. I know my husband and I, we were just watching and waiting for our age bracket to come up so that we could sign up. And we're kind of lucky because we live in a small community. And so we have just one drugstore in town. And I asked them one day, I said, "Are you going to be getting the vaccine in?" And they said, "Sure, do you want to sign up?" And I said, "Oh yeah, definitely." So I thought there'd be this big long process. Well, they pulled out their yellow legal pad and we got to sign our names on there. And a week later, we got our first shot. And this was in early February. And we were so excited. So by early March, we were completely vaccinated. And we just thought, this is so good. And soon millions of people were rolling up their sleeves to get this jab of this miracle vaccine so that we could get on with our lives. And our families gathered again this summer in June. We were fortunate. Our daughters and our grandkids got to come again. We hadn't seen some of them for 1.5 to 2 years. And to be able to gather together as family, it just meant the world to us. the restaurants and the bars and the theaters started to open up again, and the churches opened, and people were starting to gather. And we all got rid of those dreaded face masks. I don't know about you, but I am just, they just are the bane of my existence. And I just wish that we didn't ever have to have them again. But all in all, life was very good again. We just thought, okay, we're past this. We're going to start going down the downslide, and then life is going to be really good. And then bang, out of nowhere. I mean, we had heard rumors of this Delta variant in other countries, I think in England and India and different countries, but it hadn't been here. But then all of a sudden it entered this country. I don't know how, I don't know when, but it did, and it just hit with a vengeance. And this variant that is so contagious that even the vaccinated were starting to get breakthrough infections. And those who are unvaccinated, especially the younger people, they're filling up the hospitals, they're filling up the ICU beds. And I mean, right now in Northern Idaho, it's basically triage time. They're having to say that it's a crisis care moment, to where if someone doesn't look like they are going to survive, they're just going to be made comfortable, because they've got so many other people that they have to take care of. And so the relief that we all felt when the vaccines became available just was shattered. And before we knew it, that hoped for normal just disappeared. And back out came the masks and the social distancing. And even with all the renewed energy, once this Delta variant came alive, to get people vaccinated, all the months of internet misinformation, the rumors, all of the Facebook doctor experts, it's led to this crippling vaccine hesitancy, so that we still have so many people who just refuse to get it because they've heard how bad it is. And all those events that we rescheduled for this summer and this fall have started getting canceled all over again. Even though in some parts of the country, it doesn't seem like anybody really notices. But I know for myself and for a lot of people that I know that really are worried about this, we've had to just stop doing so many of those things. And with the masks and the social distancing being encouraged or either required for people to go back into the churches, we were back to the online liturgies. So that dream, and the dream of heading back into the office, became more of a wish than a reality. And a lot of people now are back to working remotely because they just couldn't be in there, especially when so many people refuse to get the vaccine and trying. So people are nervous about going back into an office situation. So this put us right back on that emotional roller coaster all over again, filled with even more fear and more uncertainty and a lot more frustration. So right now, I want you to take this time to just put in the chat box what you personally have found most challenging about the resurgence of the COVID with the Delta variant. So just put some comments in the chat box. So I see Diane feeling like going backwards. and an uncertain future. Not knowing what ministries to start up again, especially with faith formation. And COVID fatigue. I think that's what's hitting a lot of us more than anything. The isolating again, along with the anger about that. Just when we thought we were coming to the other side. And that at some point, just people have stopped caring about keeping themselves and others safe. And there being no consistency regarding many facets of life. People seem not to trust. Inconsistency of messaging across various platforms leading to confusion, and vaccinated now getting sick, some dying. I've seen that a lot where people, you know, well, even with the vaccine, there's a possibility of getting sick. And there's just a ton of frustration. Not getting together with family, not having in-person mass, hitting the pause button, limiting activities and planning. And we are now seeing care facilities going into lockdown again. To me, that's one of the saddest things, is to our elderly and our vulnerable not being able to see their families. Anyone else before we move on? Diane, all of the above. So this has not knowing how to plan for future events. Okay, and we'll talk about that as we go along, because I think all of this is, you know, that frustration, that anger that's starting to surface at the fact that this could have been controlled, to at least to a certain degree. I don't know if we could have controlled it entirely, but it could have been much better than it is right now. So this emotional roller coaster has led to a collective trauma that affects all of us in one way or another. And this collective trauma, that refers to that psychological upheaval that's shared by a group of people who all experience the same traumatic event, whether it's something that has like a mass shooting, or something that has to do with a natural disaster, or Pearl Harbor, all these different things, 9/11 that we're getting ready to memorialize in a couple of days. All those things cause this psychological trauma, and it affects groups of any size, even entire nations and societies. No one escapes unscathed when we have a global event such as the COVID pandemic, because it's everywhere. When we've had other disasters, they've affected us to a certain degree, but we didn't have to worry about nobody was going to come and shoot us down, or nobody was going to drive a plane into our house, or no one was going to drop a bomb on us. So for Pearl Harbor, for 9/11, for some, the mass shootings, we could be a little bit distanced from it, but for something like this, we're all affected. And we've all lived through the last 17 to 18 months of this pandemic life, where billions of people have suffered the grief and the anxiety and this rolling trauma of not knowing what's going to happen next. And some will be able to come out of this. Hopefully one day, when COVID is more or less under control, like the annual flu, that some people will be able to come out of this relatively unscathed. But the majority of us are going to find the aftermath very difficult. There's going to be, it's that aftermath that sometimes, looking back, that can actually destroy people when they've gone through something that is this deadly to our psyche. The COVID-19 global pandemic has resulted in both the collective and the individual mental health effects. And we don't know what the societal or the economic effects completely are going to be yet. That's still an ongoing process. But we do know that there are going to be long-term societal mental health consequences due to all of the emotional, the physical, and the economic impact that has happened. We're all affected by the 40 million people just here in the United States who have contracted the virus. Some suffering long-term effects, that long hauler syndrome that we hear about. My husband has a cousin who was in the hospital for 3 months, and he's going to have to deal with the issues with his lungs now for the rest of his life. And where some, even if they're not hospitalized, may experience symptoms months, if not years later. I've got a son-in-law who never had trouble with his lungs, but all the recent smoke we've had from the West Coast fires, he's now suffering from almost like asthma effects after he had COVID last winter. We all feel the pain of those 650,000 deaths that we've had in the United States. And our hearts go out to their families, and especially since that number just continues to creep up every single day. And millions of us have experienced the loss of a loved one or a friend or an acquaintance from this virus. That's a grief that isn't going to heal for a very long time. And also, many who were hospitalized are facing massive medical bills that maybe their insurance may or may not cover. And it's also been compounded by the social stressors, including the unemployment, the parenting without the benefit of adequate childcare, when all the daycares and the childcare centers had to close, or not feeling safe sending your children to a center right now, and figuring out, how do I work from home when I've got toddlers who are running around? And just a year and a half of lost opportunities. So we all feel this massive interruption in our lives. And we've pretty much come to the conclusion that what we thought was normal probably won't ever be normal again. So with this collective trauma, the beliefs that we held about our society are shaken and in some instances even shattered. And people start to question about the future of their society. There's an increased individual and a collective fear, that fear of the unknown. What's out there? Who do I believe? Who do I trust? What's going to happen with this? And one of the major impacts is this skepticism of the facts. I mean, we've got this fairly good sized component of our population who just don't believe that this virus is as bad as what they say. They still want to equate it with a cold or with the flu, or it's just no big deal. And if I have to hear that it's 99.8% survivable, but just that denial. And I think part of it is because when we're afraid, we do deny. And which has led to this huge mistrust of the vaccine, because when you don't trust the medical experts, then you don't trust what they want to provide for you. The refusal to comply with wearing of masks. The videos that we see of people in stores or on airplanes or at school board meetings who are fighting this tooth and nail. And this has created a massive divide among family members, among friends. I mean, how many of you have unfriended somebody off of Facebook, or you just stopped communicating with them because you know that you're just not going to see eye to eye in this discussion? The other is a damage to our national pride of how could we, the richest, most powerful country in the world, how could we have come to this point? how will we ever be able to avoid another major pandemic or another major tragedy if we're so fractured? And this also can lead to an identity crisis of when we start to think, what is it that we value? What are the things that we value most and that mean the most for us in our lives? And with some, that's even their spiritual beliefs. When we've had 18 months of online liturgies, we haven't been receiving the Eucharist on a regular basis. And we start to question, some people have even questioned, well, is the Eucharist necessary? I believe it is, but I haven't been into a church because I have asthma and I've been very, very careful. But it does make you start to question of what is our Catholic identity? What is it that makes us Catholic? And so that spiritual aspect is key. It also talks about what is our role and in society and our purpose in life, especially for ministers who have lost their positions. You not only lose your job, but you lose all those ministerial relationships. You lose your identity as your vocation, what it is to be a lay minister. Any of us who have lost a job in ministry at any time, it's been, it can be very traumatic, and not knowing, you start to question, who am I really? What is my job? Where does God want me to be? And but when something like this, where it's forced from something unseen, it makes it even harder sometimes to grasp a hold of. And the other is that mental and emotional distress that for some is going to lead to a deep depression and possibly PTSD for a long, long time into the future. There's that increased feelings of vulnerability. How can I keep myself and my family safe when this virus just mutates on its own? It does its own little thing. And the people around me are not willing to cooperate. So we start feeling very vulnerable. And then just that heightened vigilance for any new threats. What's around the corner? What is it that we're going to face next? Okay, so I've given you all this heavy stuff. But what I want to do now is have us break out into the breakout rooms and just take about 10 minutes to just talk about what of the whole COVID, especially with this Delta variant, the impacts do you feel has hurt your personal as well as the collective recovery from this pandemic the most? So Jamie will pop up those breakout rooms, and then we'll discuss and then we'll come back as a large group and just do some highlights. So, all right. So what kind of was there anything in particular that stood out in your small group conversations that anybody'd like to share?
I think one thing in our group, Kathy, that we all appreciated was the whole introductory piece that you did. In a sense, it's like it all put it together into words, into one place, and none of it's our imagination. And yes, we are experiencing that, and it just put it all together in a way that made it real to express many of our emotions and our feelings and our experience in that.
Anything else before we move on?
Kathy? It seems to me that our conversation, at least our small one, had a different tone than the ones we were having a year and a half ago. And I need to live with this for a few minutes to say it, but I think there's more wounding and more wisdom, and we've been through so much now. It just sounds different to me, and I hadn't realized that.
Okay. It's that rolling trauma. I think, you know, we're going to have our hills and valleys, and it's going to hit us in different ways at different times. So let's go forward. And so as we go through this collective trauma together, and all this uncertainty and all this fear, it has to have a major impact on our church. And for ministers, for anyone who's been involved in the church for most of their lives, or at least their adult lives, that this is a major thing, that it's almost hard to put a handle on exactly what it is to not have that safe haven available on a regular basis. And we do know that as a people of faith, we usually always have hope. There's hope in the midst of chaos. But the one question that I think is in the back of my mind quite a bit is, can our ministry, at least the ministry in the way we have known it, can it survive in a post-pandemic church? What's that going to mean? So we know that even though many of the parishes have opened up, at least to a certain degree, to in-person attendance, this Delta variant that showed up, then, I mean, I was just getting ready to go back to Mass and to get off the screen of watching it. And then a couple of things came up over a couple of Sundays, so I wasn't able to go. But then I was going to go the next Sunday, and then the Delta hit hard in our area. And in fact, one of our major parishioners passed away from it because he didn't think the vaccine was necessary. And so things really tightened up. And so that fear of the virus is making many parishioners, I know I'm not the only one, reluctant to go back into the churches for Mass. And and now that with the masks and the social distancing again, it's just easier to stay home on Sunday. And there's always that temptation to, do we log on to the online Mass, or do we sleep in? Do we watch the football game instead? Or do we, you know, I mean, there just isn't the drive that there used to be. And so with all this chaos and uncertainty, the question that I think comes to the forefront is, what if they never come back? Those people that have kind of pulled away. And after a year and a half of these online liturgies and the cancellation of all those routine parish events that we've always had, the Knights of Columbus beer tasting and the parish picnic, and our parish always put on every year a wonderful international food fair where we would have people from at least 8 different nationalities who would have food, and that was a big draw for people. People would come. We had, the ladies were always doing these dinners as fundraisers, but we would, you know, gather and we would get together for those. Those were all canceled. Those diocesan events, the diocesan conferences and regional events, the NOM conference, all the different things that we don't have as those gathering points to pull us back together. The Zoom only faith formation, so that we don't have that one-on-one contact with the students and with the people who come to us looking to join the church, the RCIA and the children's formation classes. That it's almost realistic to come to the conclusion that the experience of the church after COVID gets to the point where it's somewhat minimized, where we can actually live with it. That things are going to have to be different. They almost can't stay the same. Some parishes did a great job of keeping connected with their parishioners and reaching out and keeping them engaged in what was going on, had online offerings and things. But there were also, and I would say my parish included, who were very lax, and their only contact, I know for me, was that letter or that email or that thing on Facebook asking for donations. And that doesn't exactly spark an inspiration for people to remain faithful community members. And they start to disengage a little bit more. So I know we just came out of the breakout rooms, but I want to go one more time and just to find out what everyone has been doing out there over this past year. And to talk about, was your parish successful in staying connected to the parishioners? And if yes, what made it successful? And if your parish was one of those lax parishes that didn't do a lot, how has that lack of communication affected your ministry? So again, Jamie, if we can do another 10 minutes and we'll talk about this, and then we'll get into a little deeper of what the church may look like moving forward. Okay. So it sounds like I'm not going to do a review of some of the discussions, but you know, you can kind of take what you learned from each other and see what's working and what needs a little more finesse. So as we've been talking about this whole thing about, you know, that are they going to come back and stuff? Well, it looks like there's many church experts who have been forecasting fewer Catholics in the pews for quite some time. And many of those before the pandemic who were just attending Mass out of habit instead of a real, real love for the church, they probably won't survive the long period of no in-person masses, that the parish activities have, are not there to draw them in, and just having that general overall feeling of connectedness. So the feeling is that there's going to be some that are just not, we're just probably won't see them again. The number of regular Mass attendees was already dropping before COVID, and many experts feel that the pandemic has just speeded up this process. One of them is Timothy O'Malley. He's the theology professor for the McGrath Institute for Church Life at the University of Notre Dame. And he has said that the crisis that we're going to experience in church is the rise of the nuns. Not that religious kind, but those ones that are just gone. There is a sense of a sort of a lost generation. And he goes on to say that the people who are going through the motions of attending church basically out of an obligation, but not out of a real love for the religion, dropped off during the lockdowns the first time, when many of the churches were closed to Mass, and many of them didn't return once the churches reopened. And another one of these experts, Matthew Mannion, the faculty director for the Center of Church Management for Villanova University, has said that fewer people attending church will require a radical restructuring of parish life in many parts of the US in the post-pandemic era. And he went on to say that I think the pandemic has clearly been an accelerant of changes and trends that were happening in the church already. And I found this interesting. He went on to say that I think what the pandemic has done, let me go back, that before the pandemic, he predicted that in 2030, there would be about half the number of people in the churches than there was in 2010. But then he said that I think what the pandemic has done has brought that window way forward. So it's not going to be 2030. It could be 2022 or 2023. So this is just a couple of years from now that we could actually be looking at half the people in the pews than we had 11 years ago. So in the chat box, I want you to just, what are your gut instincts about what these guys are talking about, their findings and some others that probably you have read of and your experience of what you've seen over the last 10 years. So Peggy says that I agree with them that I think we need to revise our concept of church. Any other thoughts? I think we need to find more innovative ways of engaging people in their faith. Chris has a feeling of a sense of gloom and doom, at least in his area, in his diocese, that they are expanding parishes, especially within the Hispanic community. And Diane, one question that comes to mind, what are the cultural and ethnic aspects of these statistics and projections? I think that's an excellent question, Diane, because I don't think they didn't get into it in what I saw, but that would give us an idea. There seems to be a sense of apathy, people not practicing their faith just because, no special reason. And I think it is our challenge. We are at 77% pre-pandemic attendance, and our worship committee is looking at strategies to achieve the goal by increasing by 10% of next year. And the research gone predicted the rise in disaffiliation in 2015, I think will spur a revisioning of parish life and structure. So I'm seeing that there is already, some of you are already sensing, let's see, it looks like we've got one more. I think our church will need to take time to reflect on this reality and look at strategies moving forward. So that's kind of what we're going to talk about as we move into this last segment here, and see just what it is that we can either possibly get those people back into the churches, or what can we do for those who are coming, how can we make it a more dynamic presence for them? So here we are. We're stuck in the middle of this ever-evolving pandemic, and we have fewer people already predicted in the pews. And so we're constantly and we're faced with those decisions that have to be made every single Sunday. Things come down from the CDC. So it's, can we have in-person masses? No, the CDC is, no, the numbers are rising. We've got spikes in cases and stuff. So do we go back online? Do we have a hybrid of both? Do we require masks and social distancing? Now, I know some of you come from areas where you haven't had that many cases, you have a high vaccination rate. And so maybe it's a little easier for those places to be able to go back to in-person and have it feel like it used to be. And for other places like in Idaho and in these ones that have a lot of cases, not so much. Do we hold faith formation classes? Can we bring the kids into a classroom again with a mask and some social distancing, or do we continue with the Zoom process? And so it's really hard to know what decisions are right during this period of time. And all this uncertainty leaves us all feeling very lost and confused and unsure and puzzled. And this is especially difficult for the lay and the ordained ministers who are tasked with just continuing that work of Catholic ministry on a day-to-day basis, because it still has to take place. The church still has a mission, but how do we accomplish that? So what do we do with all that? Now, I know a lot of us, I know for me, I would love, there's many, many days, and especially when I was in the depths of ministry, that I would have loved to have just created this little blanket fort in my office. And I would have been perfectly happy to have crawled in there, maybe with a glass of wine, and just pretended that nobody else was out there. And you know, it's that temptation of, do we panic? Are we paralyzed with this frustration and fear? Do we not know what to do because the decisions start to be so heavy on us? And do we just hide in our little blanket fort, waiting for all the adult decisions to go away? But another way, though, is can we get rid of that old mindset, and can we do a reset? And if all the experts are correct, and it looks like they probably are, that the future of ministry is going to be within a church with fewer people in the pews, which means some challenging decisions are going to have to be made. Massimo Fagioli, professor of historical theology at Villanova University, has said that a smaller and more humble church isn't necessarily a bad outcome for this moment in Catholic Church history. And he went on to say that it gives the people in church communities the opportunity to enrich their faith in the gospel, find new ways to worship, and ultimately employ better methods to evangelization to help their parishes flourish. So for someone like me, who is a glass half full kind of person, I see this time as God's just trying to get our attention. God's just trying to get us to open our eyes to what has been right in front of us all along. But we were just too busy keeping the status quo. Sometimes I know in ministry, a lot of times it's just keeping our heads above water, just keeping things going. And we just didn't see that there were already changes that needed to be made. So this shakeup in the Catholic Church that was already taking place and sped up by the pandemic gives us, I think, a great opportunity to do a major reset and look at all those previous notions of ministry and to branch out in new and creative ways. And since COVID and the effects of this global pandemic are going to be with us for some time, now's a great time to do that out of the box thinking. And we know that we're going to need a new approach to formation. And we're going to need a new approach to outreach and evangelization. And these new approaches will probably require a total renewal of lay Catholic life. How do we get more people involved? How do we reach out? You know, who are the people that we could fold into this? That when life is turned upside down, anything can and should be on the table. Now, we've all had to, over this last 18 months, we've all had to adapt to Zoom as a way of life instead of face-to-face interactions. Now, for some, this was an easy transition. I was very fortunate. I had been doing the online webinars for catechist certification for our diocese for about 6 years before this all hit. So I was getting rather accustomed to it. I still wasn't, I wasn't a perfectionist by any way in it, but I could make it work. But there's a lot of people that took them completely out of their technology comfort zones. And we've all experienced the internet glitches. In fact, I had trouble logging on today. I got bumped off once and had to come back. So the login difficulties, the mic issues, the barking dog in the background, or in my case, the cat jumping up on my lap. And just all of that craziness, that's just everyday life when we are relegated to being at home and doing our meetings, doing our work. But guess what? The majority of us have mastered this Zoom messiness, making it just an ordinary part of our day. Now we're getting all very proficient in logging on and being able to, and to have those family gatherings, to be able to keep in touch with our children, to be able to do things that we would not have thought imaginable 5-6 years ago. And so the pandemic has actually thrown open the door to new motivations and to try new things. So some of which we may have wanted to try for years, but we were constrained with that we've always done it this way mentality. So these new and creative ideas could actually inspire something very exciting and even necessary reforms for the post-pandemic church. So at this point, I want, again, we're going to go into our breakouts, and I'm going to take about maybe, let's go 12 minutes instead of the 10. But I want you to share, what are the things that you've already gotten to try during this past 18 months? Those new opportunities that you've used to sustain your ministry and that you've been able to do during this pandemic. And then also, what are those creative ideas that you would love to implement in your ministry? You know, those things that you've had in the back of your mind all along. I remember when I was in parish ministry, and I would come back from conferences and I'd have all these fantastic ideas, and I think, oh, I know they're all going to fall in love with them, and they're just really going to think these are great, and we're going to do all these wonderful things. And all they do is like, oh, here she comes again. And so I would go back to, well, we've always done it this way. But let's look at, what are those ideas that you would always like to implement in your ministry to help it to thrive in the post-pandemic church? And well, what came out of your conversation that you want to share?
Well, I'm going to highlight what we said at the very end of ours. And
Okay.
Marty, it's actually a takeoff on something you put in the chat. But our last conversation was, we think that whole synodal process needs to be looked at through the lens of COVID and the divisions that COVID has brought to the forefront of the church. That this whole COVID experience has really, I think, highlighted some fractures in the church. And I think that it would be, I almost said ridiculous, but I mean ridiculous, to have a synodal process that didn't somehow take all that into consideration. Mm-hmm. So, and then I don't know if you saw in the chat, Peggy found the link for the synodal process if you're looking for that.
Anyone else that has something that came out of your discussions?
I think just a general one was that we should look at the pandemic as giving us opportunities to newly strategize versus a negative. Mm-hmm. It has forced us to look outside the box. And if we look at it that way, we may be able to accomplish some really good and great things.
Right.
Peggy, did you post that link in your small group? If so, could you post it in the big group?
No, I see it in the big group here. Do you see that in the group chat? I see it.
Well, maybe it's just because it was in our group. So Peggy, maybe if you can post it again in the chat while we're in the large group. One of Zoom's little quirks. Anyone else before we move into closing prayer? Okay, well, I thought for our closing, I was trying to figure out something to tie this all up. And I know that because of what we're all going through, the frustration and the uncertainty and just the knowledge that we're not in charge, I came across this. And so I want to, if I can get it to work, there it goes. So let's just take some time and we will meditate on the footprints in the sand. So I want to thank you for joining us today. And hopefully this was helpful. And if you have any suggestions of what you'd like to see moving forward as we continue to crawl our way out of this pandemic, and see what we can do to really brainstorm and spark those creative ideas. So thank you all for coming.
Kathy, I want to thank you for this wonderful presentation and for the dialogue and the small breakout rooms. Thank you so much.